Well, let's come back to you then. Interesting moment. What are your criteria, your coverage criteria for using these CGRPR antagonists? What do you require?
I think we discussed it's similar to Botox, so we want them to try a couple other preventative methodologies, and if those don't work, then a prior auth.
So you need a prior auth. You sound to me, and not unreasonably, you want some step therapy. In other words, if aspirin works, why go further? Right, because aspirin's cheap and over the counter.
Right. And in this case, it would be the preventative therapy, so beta blockers and
the phrase prior auth rolls off your tongue like little honeyed drops.
I can just say auth. Does that sound better?
No, it sounds awful. Truly. In this regard,
Yeah.
it sounds like paperwork.
Yeah.
It sounds like a lot of back and forth and explain yourself when all the person wants is a drug that works.
Right.
So how cumbersome is it to get a prior auth for one of these new drugs?
Well, it's a relatively new drug. I mean, it just came out the end of May, was it? And the biggest issue right now for people who are trying to get the drug is the demand is so great that the pipeline is, it's difficult to get.
Are you saying supply is an issue?
Yes.
Is that going to drive cost up?
No.
Why not?
Because
I
they
went to college, they
promised
taught me that.
us.
I think they set the prices, right?
Yeah, they set the prices are set.
Who set them?
Amgen.
Okay, and they're going to stick to it. All right. So one, we can't overload the pipeline because there's not enough to go around, is what I'm hearing you say.
I didn't say we shouldn't overload the pipeline. I'm saying
But
that
we could.
Yeah, we could. Yeah. Because
In
it's
your
a novelty.
experience, clearly you live in the land of Oz and your program is perfect, but others not so much. Do your patients have appropriate access to these drugs, and have you heard of other areas where they don't?
As I mentioned before, there are plans that are requiring UCNS certified physicians to prescribe them. By and large, though, the application process is fairly straightforward.
Okay, and what about formularies? It's one thing to do this on a one-off basis. Do you plan on approving this in formularies and just having scripts for them going forward?
Well, they are part of the formulary now.
Okay.
But as we discussed, you have to try a couple of the other more established agents first,
Okay.
and to meet the criteria for these. And I think, but I do think, as I mentioned before as well, that access can be an issue even in a state that has, certified neurologists, because can be hard to get into. So I still do worry about patients, members not necessarily getting the medications they need. I think that's a universal issue.
Mm-hmm.